CPAP is becoming the standard of care when it comes to taking care of our patients with CHF. But now we're starting to see CPAP being used on asthma as well as COPD patients. So as a paramedic, now I got to think about one O2 source for the nebulizer and another O2 source for CPAP. But wouldn't it be great if there was one product that allowed me to use one O2 source for the nebulizer and the CPAP? Well, I'm going to show you that product today. I'm Chris Cebollero, and this is the Innovation Zone. In a past episode of the Innovation Zone, we had the opportunity to take a look at the FlowSafe II mask from Mercury Medical. It was a disposable CPAP mask and very, very innovative for its time. But now more agencies are starting to use CPAP for the treatment of asthma and COPD as well. And some of the things that we're utilizing with those protocols is nebulized aerosol with that CPAP mask. But think about the challenges that we have with that. If we have a CPAP hooked up, we need an oxygen source. Now if we use a nebulizer, we need a second oxygen source. So always the innovators at Mercury Medical, they've decided to come out with a new product called the FlowSafe II EZ, which is going to give us the tools necessary to treat these asthma and COPD patients. Well, let me show you some of the advantages of the FlowSafe II EZ. Well, first off, the thing to know is it uses 50% less oxygen consumption. And think about that. When we're on those long distance transports, if we can use less oxygen, how great is that? But secondly, what's really innovative about this product is it uses one O2 source. Again, if we have an O2 source for the CPAP machine and we needed one for the nebulizer, that's two sources. But now we have the opportunity to use it in just one. And I want to show you some of these characteristics. First off, it has a manometer. The manometer is always great because it takes the guesswork out of where is the pressure on the CPAP mask. So think about it. Without the manometer, we have to guess, and hopefully we're delivering the right CPAP pressure. 12 to 14 liters per minute hopefully will give us 8.5 to 10 centimeters of water pressure of delivering CPAP. So one of the things I want to show you is it comes with a standard continuous nebulizer. The nebulizer just hooks in as it always does. But what's really great is now we have an on-off switch. So one of the things that we need to think about is if we need to place more medication in the cup, we can go ahead and turn the green valve off. We could take the cup off, go ahead and put the medication in, install it again, and then turn the medication back on. You know, as a paramedic, I got to tell you that I really love this device. Anything that makes our jobs easier as well as gives the patient a better benefit is really a great product. So one of the things I want to do is I want to show you some of the highlights of the FlowSafe II EZ mask. You know, one of the things that I really like about it is it has this little swivel arm which allows the works to move. And that's really great. When you have all that weight there, if it moves with the patient, it really gives them a lot more comfort. I really love the forehead pads. It rests on the forehead, which really makes it more comfortable for the patient. One of the great things about it is you have the opportunity to go ahead and adjust it, which takes the pressure off the nose. And again, it's a very, very lightweight mask, but still gives us the opportunity to kind of make it even more comfortable for the patient. This great harness allows it to be as comfortable as possible around the individual patient, and then it also has these Velcro straps, which will allow you to kind of put it around their head a lot easier. One of the things that I really like about this is the quick release clips that gives us the opportunity to get under the mask if we need to without having to remove the whole mask. You know, we talk about the mask and it does allow us to have a really great seal, an anatomically correct seal, which doesn't allow that blow by. And you think about the trepidation of these patients in CHF, in asthma, you don't need to have all that wind coming past their face. I really love this product. As an ALS provider, it gives me the opportunity to go into the home with one O2 source, deliver aerosol medications and CPAP, and not have to worry about multiple bottles of oxygen. The FlowSafe II EZ from Mercury Medical. This is innovative, it's lightweight, it's easy to use, it's comfortable for the patient. You know, CPAP is becoming the standard of care, and the advantages of the FlowSafe II EZ from Mercury Medical makes my job as a paramedic easier to take care of those patients. I'm Chris Cebollero, and thank you for joining us on the Innovation Zone.